Besides giving back the gift of sight, this hospital had identified that a lot of patients were also deprived of hearing due to hearing impairment, which they got either at birth or through some disease, and this majority affects the children. So as a result, the Lions fraternity decided that we needed to get specialist help. There was a shortage of specialists in the country, and yet there was a huge demand for this. Through our partnerships with fellow Lions around the world, we were able to engage a group of ENT specialists from the Scandinavian countries. They were actually very keen. Our values were shared, we had mutual beliefs, and the idea was to be able to give a solution that was sustainable and that would be more impactful. So for the last over 10 years, we have been having our Scandinavian doctor partners who come to the Lions SightFirst Eye Hospital twice a year and offer free surgical service.
It's important for me to do the work here in Kenya because there are many poor people. There are not a very good and expanded system for especially ear surgery, and we have many patients suffering from ear diseases, and it's about the hearing. It's very important, especially for young people when they're going to school. It's very important for social communication and in professional situations.
I have been to Kenya before with another organization, and after several years this came up to be able to come to Loresho to do ear surgery for Kenyan people. And as I knew that it's not an easy thing to get ear surgery in Kenya, I was interested to come.
The meaning of this camp is to help the Kenyan people, ordinary people, for ear diseases and hearing impairment, which can be treated by surgery.
The ear condition here in Kenya, what I have seen, is more severe than it usually are in Sweden, because people go for a very long time with their disease without getting help.
It's a common problem all over the world, especially young children experience ear infections, maybe with a small hole, a small perforation in the eardrum. But when you're not treated, when you not check it in the right way, it can develop to bigger holes and to bigger problems.
People need to take care of their ear, because if it's fluid or hearing loss and you don't seek advice for it and medical care, it can be a worse disease. Small perforation and hole in eardrum can be very large.
A common problem we meet here is that there is a destroyed eardrum, and there's also destroyed middle ear structure sometimes. And this is important for the hearing of the patient. The patient's suffering from discharge, some recurrent infections, and this is not good for the patient and for the patient's ear.
The surgeries we are doing are all types of problems in the ear, with narrow ear canal, loss of tympanic membrane, diseases in the vicinity of the middle ear and the ear bones.
The team which is here for the camp is dedicated to offer help. We always had the wish and to come and help poor people. But you cannot just come to Africa or another country and say, here we are and we can help, we can do. We need an infrastructure, we need partners which can offer us a possibility to do this work. And we found this here at this Loresho Lions Hospital and wish to develop it further.
This hospital has mainly been equipped by donations from Scandinavian country. Ear surgeon before that has been here, and even when we come, we have things with us It needs to be special instruments, microscope, and it's a very long training to be an ear surgeon also. So it's just about competence and equipment.
Team members consist of one anesthesia doctor, one scrub nurse, and 3 specialized otosurgeons.
It's challenging for us to perform everything we actually want because there is a lack of equipment. We would be very happy to get more donations from all over the world to have more equipment, to can do even more surgery and more advanced surgery to help more people in a very good way.
We try to keep it as cost effective as possible, but these treatments are not otherwise available, and these doctors come in, screen the patients, offer preventative information, train our local teams to manage them, and then provide surgical intervention.
After all, now when we have finished, we have done a lot of qualified operations. We have solved most of the problems, not all, but we have been able to give a good service in the operations of the patients we have been presented.
Notice that the child doesn't hear, it does maybe not develop with the speaking, and so it can be a sign of hearing loss, and it's important then to go to do audiometry in an ENT clinic.
We recommend check the ears after infections, especially when they're recurrent infections, when you realize the child is hearing bad. So make a check, and when you can treat the ear earlier, it is much better.
If you have problem with your ears, hearing loss, or if it discharge, you should seek medical care to have medicine or see to check up what you need. The problem is that it's very few ear surgeons available in Kenya, so it's difficult for Kenyan people to have help for their ear problem and hearing.
It's very nice to see the people both before and after our surgery. They have huge problems with their ears, the hearing is bad, and right after surgery we sometimes see already good improvement. The patients are very grateful, very thankful.
It's satisfying to be able to help people.
This time I will go home with the memory of we have done more operations than before. So in that way we have solved the logistics better here in the operation theater.
So we actually wish to can help even more people, and especially the very poor people. They don't have an insurance company, they don't have money to pay for the treatment. We have partners here to help us doing this, but this is our deepest wish to do it even more. We have visited some very poor people, and it's hard to see for us, and this is why we come back. And we hope we can continue and improve this kind of treatment.
This has been the extent of the partnership, and what we can tell you that we have operated over more than 300 patients in the time that we've done. And this is the impact and the benefit of this partnership. We intend to grow it. We also intend to do more training, and today use the advantage of technologies to be able to serve our patient needs and make sure that they get access to quality health care and dignity, and we can return their ability to hear so that they are able to live a good, productive life.